So thank you for joining us for a brief dive into COVID-19 vaccines. Although I just need to, there we go. Okay, so let's look at how vaccines work. A vaccine starts with a pathogen, which is a disease-causing bacteria or virus like SARS-CoV-2, the virus that causes the disease COVID-19. The vaccine then introduces the pathogen to your immune system. And this introduction results in your immune system recognizing and remembering that pathogen. That memory takes the form of antibodies, which you'll hear about in the next slide, as well as B memory and T memory cells. So this is a graph of the antibody response. After the first exposure to a pathogen, ideally in the form of a vaccine, you see a smallish and slowish response. But as a result of that first introduction, if there is a second exposure, like to a person contagious with SARS-CoV-2, the immune response is bigger and faster and stronger, meaning that the vaccine enables your immune system to respond more quickly and more powerfully to control the infection before it can make you sick. Vaccines are considered one of the greatest public health achievements. They almost work too well because a persistent challenge is that it's hard to visualize people not getting sick and not dying. It's hard to see the 500,000 people who didn't get measles this year in the United States. Think of it this way. Globally, vaccines prevent around 2.5 million people from dying each year, which is about 5 people a minute. So for every minute of this 10-minute presentation, imagine 5 more people in the room with you. Those 50 people are the folks whose lives were saved due to vaccination in just these 10 minutes. When developing a new vaccine, there is a specific, consistent process of testing and approval. People have voiced reasonable concerns at the speed of COVID-19 vaccine development. I feel confident that the process was fast, but not rushed, and no corners were cut. Confidence comes from knowing that all the steps of the established process were completed. No steps were skipped. Some steps were combined, and many were done in parallel rather than in sequence, but the process was complete. In addition, much of the preclinical work on the authorized vaccines has been underway for decades, since the 90s. Scientists have been doing similar research for years, testing vaccines for Epstein-Barr virus, Zika virus, and others. There are loads of safety and efficacy data. And this foundational research is one of the reasons they were able to produce a safe and effective vaccine so quickly, not by cutting corners, but because they'd already done part of the work. Another way to think about it, these vaccines were produced fast, and they are very, very good. It just was not an expensive process to make that happen. So let's come to COVID-19 vaccines. These vaccines work in the same way that others do. They introduce the virus or some part of the virus to your immune system. In this drawing of SARS-CoV-2, I want to point out the spike protein. The virus uses this protein as a sort of key to bind to and enter our cells, hijacking them and forcing them to become virus replicating factories. Many COVID-19 vaccines employ creative but not untested ways to induce protection using this protein. There are 2 currently authorized vaccines in the US. This authorization means that they have gone through extensive testing and review. Tens of thousands of subjects were included in clinical trials in the US alone, and since authorization, tens of millions of people have received the vaccine. If you're receiving the vaccine now or soon, hurrah, I'm delighted for you and a little bit jealous. And I want you to feel confident that you are not at the front of the line for an untested vaccine. So these 2 vaccines, rather than deliver any part of the virus, deliver genetic instructions like a recipe for how to make the spike protein in the form of messenger RNA. After vaccination, your cells follow that mRNA recipe and make spike. This enables your immune system to learn to recognize and remember the spike protein so it can do that bigger, faster response if your immune system sees it again. Since there is no infectious virus in the vaccine, it is impossible to get COVID-19 from the vaccine. It is also not possible for the vaccine RNA to become incorporated into your cell's DNA. There are a bunch of other vaccines that work in different ways that are in the process of development and authorization, including a single shot vaccine from Johnson & Johnson that the FDA just began reviewing for authorization at the end of last week. But regardless of the type, the goal is always the same: acquaint your immune system with SARS-CoV-2 so that your immune system is empowered to keep you safe. The authorized vaccines reduce the risk of COVID-19 disease by 95%. It's amazing. That protection is reached 2 weeks after the second vaccine dose. While there is lots to learn about long-term immunity, we should celebrate these stunningly excellent results. Plus, new data for additional vaccines are also incredibly positive, which is good news because we need as many tools in our toolbox as we can get to curb the spread of this pandemic. I want to note that these trials measured how effective the vaccines are at preventing disease. The trials did not measure whether you can be infected and transmit after vaccination. That research is still underway. So what does that mean? It means that even if you've been fully vaccinated, we still need to be using all of our prevention strategies. Please, please, please keep wearing your mask, physical distancing, avoiding indoors and crowds so that you don't inadvertently transmit the virus to someone who hasn't had the opportunity to become vaccinated yet. This is particularly important since we know that this epic undertaking of a mass vaccination campaign will take months to fully implement. Your vaccine protects you, and your mask protects the rest of us. All health behavior decisions are a balance of risks, whether we realize it or not. Every time we get in the car, we are accepting a huge amount of risk, but we perceive that the benefit, the convenience of fast, reliable transportation is worth the risk. So what risks are we balancing here? Risks of the vaccine. There are relatively frequent mild side effects, a day or two of fatigue, soreness, fever. These are all signs that the vaccine is working, that your immune system is responding to that introduction. Contrast those relatively mild and short risks to the risks of COVID-19. Individual risks of severe disease, long-term symptoms, healthcare costs, or death, plus societal risks of an overwhelmed healthcare system and a faltering economy. Whereas the benefits of the vaccine are basically the opposite of the risks of COVID-19. Reduced risk of severe disease, eased healthcare system burden, and hopefully economic recovery. The benefits of COVID-19 are elusive to me, honestly, particularly considering that there is some data suggesting that the immune response to the vaccine seems to be more robust and persistent than immunity after infection. Another way to think about this, in the US, 42 million doses of the vaccine have been administered since mid-December. There have been no long-term hospitalizations, so there have been a few short-term ones related to allergic responses and 0 deaths. Whereas we have had 27 million cases of COVID. Currently, 80,000 people are hospitalized in the US with COVID-19, and 460,000 Americans have died in the past year. You may have people in your life who are hesitant about this vaccine. Maybe you're feeling hesitant. For many folks, this hesitancy is not unreasonable. Many people have not been treated equitably or ethically by the medical and public health systems. People of color, people experiencing poverty, women. This distrust is valid, and it is up to us to rebuild that trust, to become trustworthy in order to have productive conversations. So if you are engaging in these conversations, please approach with empathy, ask and listen. Don't just beat people over the head with data. Direct people to trusted resources and just acknowledge that this is a process. So thank you for your time, and say hey to those 50 folks in the room with you whose lives were saved by vaccines.